At Northwell, we utilize evidence-based care pathways after surgery to get you back to your regular activities as soon as possible. Our post-operative pathways are grounded in research and have been proven to reduce the stress of surgery, decrease narcotic use, lower post-operative complication rates, and shorten the amount of time spent in the hospital. It's important to us that you and your loved ones are prepared and understand what to expect during each phase of recovery. You are at the center of all we do, so please ask a team member if something is unclear. You will wake up from surgery with a tube that goes through your nose down into your stomach that will empty your stomach contents, a Foley catheter into your bladder that will drain your urine, an IV catheter that will go into either arm to give you IV fluids and medications while you're not eating, and the cuffs around your legs that were placed in the operating room. You may also have drainage tubes to collect pancreatic secretions. Our goal is to make you as comfortable as we can. Trust that we will remove these devices as quickly as medically possible. The staff will check your vital signs and blood sugars while in the hospital. A nurse will also draw your blood to send to the lab to be analyzed. We are thoughtful about when and how often to draw your blood and limit the amount of draws where possible. Medication will be given through your IV until you begin to eat by mouth. We will then transition the IV medications over to oral pills. You will be given a blood thinner after surgery, which is very important and will help reduce the risk of blood clots. Many patients are also discharged on a short course of the blood thinner to be taken at home. There are two things that you as patients can do to help speed up your hospital recovery. The first thing is walking. You will be up out of your bed and into a chair with assistance, either the same day as surgery or the morning after surgery. When you lie in bed, you become more deconditioned, which makes recovery harder. When you walk, you are circulating your blood, which decreases the risk of blood clots and also helps prevent constipation. Caregivers can help push IV poles and keep you company in the hallway. The other thing you can do to help with your recovery is deep breathing. You will be given an incentive spirometer, IS, which is a machine that helps to keep your lungs open and prevent pneumonia. You suck through the end like you would suck through a straw and take a slow, deep breath. Your goal is to do 10 deep breaths an hour while you are awake. Here at Northwell, we use what is called a multimodal approach to pain, meaning that we use different types of medications to control pain after surgery. During the first few days, you will receive medication directly into your IV or epidural catheter. But once you are taking in more by mouth, you will transition over to pain pills. You will be given a number of non-narcotic pain medications that you will continue to receive on a schedule. If you need more pain control, we also have narcotic medications available. You will be asked to rate your pain from 0 to 10. We do not expect that your pain score will be a 0 after an operation like this, but your pain will be controlled to enable you to do the deep breathing and walking, which is most important for your recovery. Before leaving the hospital, you will receive a discharge packet that will outline all of your new medications and your home medications. We offer to fill your prescriptions here at the hospital, so there is one less stop you have to make on your way home. If you are not given a follow-up appointment with your surgeon before you leave the hospital, please contact their office after discharge and the medical assistants will help arrange that for you. The recovery process after an operation like this is longer than what most people expect it to be. It takes an average of 2 to 3 months before you are feeling like you do right now. You will be able to take care of yourself and do your activities of daily living, but you will feel tired or fatigued at times. Your energy level will get better, but it takes time, so please be patient with yourself. You will not have any activity restriction other than no lifting greater than 10 pounds for 8 weeks, which is like carrying a milk jug in each hand. You will be able to go up and down steps, and we encourage you to continue walking at home. We expect that you may not have an appetite when you get home, or you may get full quickly. We recommend eating small, nutritious meals throughout the day that are high in protein to help with healing. Supplement shakes are also a good option during your recovery process. Blander foods tend to be tolerated best, but you will not have diet restrictions when you get home, so please try to eat what appeals to you. Please see the nutrition document provided by your healthcare team for more in-depth information regarding your post-operative diet. There are also additional handouts in your packet that outline the information discussed in this video. At Northwell, we deliver high-quality patient and family-centered care and tailor treatment plans as individual as each of you. Please let us know how we can make your recovery and time here more comfortable, and we thank you for the privilege of serving you and your loved one.